Finding out if you have COVID-19 may soon be easier than ever. That's because of a new at-home test that promises to deliver results within minutes. Haley Rush with the Fox 12 Investigators takes a look at the risks and rewards of this new option.
Many people wouldn't consider getting a COVID test convenient, but that could change with a new test you can buy over the counter. The only question, do health experts recommend it? We decided to find out. Fast-tracked and backed by the FDA, the Illume COVID-19 home test is expected to land on shelves soon.
The benefits outweigh the disadvantages.
Fox 12 spoke with Justin Sanders about the new testing option. He's the section head of molecular diagnostics at the Oregon Veterinary Diagnostic Laboratory and a principal investigator of the TRACE program at OSU, a study where people are randomly tested for COVID-19 at their homes.
What are your initial thoughts hearing about these at-home tests?
I think, anything we can do to increase the accessibility to testing is really important. Identifying cases of SARS-CoV-2 is critical to interrupting transmission.
The test by Illume doesn't require a prescription. It's a nasal swab and promises results within 15 minutes. It's safe for ages 2 years and up and will cost around $30. It's expected to be available at pharmacies and convenience stores as well as online.
Are you worried with at-home tests there could be more user error?
Yeah, of course, there's going to be more user error, but there are trade-offs with any of these tests that we're using. And the fact is, more testing really is needed. We now have a vaccine, but still identifying cases and allowing them to isolate and disrupt the chain of transmission is critical. So I think that the potential for user error is really outweighed by the public health importance advantages of this.
That home test is antigen-based, also known as a rapid test. While it provides results quickly, it's been known to not be quite as accurate as a molecular test, also known as a PCR test. PCR tests are sent to a lab, and it usually takes a couple days to get results.
There's really no one-size-fits-all. When it comes to testing, we need to maintain the ability to do PCR-based testing. We need to have wider availability of at-home rapid tests, while maintaining the public health measures that we know work.
Sanders does make it clear at-home tests aren't predictive, and with the potential for false negatives, shouldn't be used as a green light to hang out in big groups.
They don't mean that you're not currently infected, but perhaps in a state, an earlier stage that you're not currently transmissible, but could be within the next day or two. In combination with public health measures, social distancing, wearing masks, it's an important tool, but we need to use it as such.
Overall, he says tests like this one are still a step in the right direction.
One of the disadvantages of COVID testing is it requires a doctor's order, or oftentimes are costly. They require specialized equipment. Something as cheap and simple as a pregnancy type of test where the patient actually does their own interpretation of the results would really increase the amount of testing, and people could make informed decisions as a result.
The FDA has backed 2 other at-home tests, but they require a prescription first. No exact date on when the at-home test will hit the shelves, but it is expected to be early this year. Haley Rush, Fox 12 Oregon.